Kirsten, hello, how are you doing?
I'm okay.
I looked at Jenny's X-ray and CT scan images. Unfortunately, she suffers from craniosynostosis, as we suspected. The images show that her suture has fused prematurely.
Okay.
Baby skulls have openings called sutures, which allow the brain to grow. In the first year, the brain triples in size, continues to grow until they're 12. Can you tell me a little bit more about her symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her. But I was sure something was wrong. She's in a lot of pain.
I'm sorry to hear that. Jenny has the condition craniosynostosis, but her skull shape is almost normal, so it could have made it more difficult to diagnose. Craniosynostosis is uncommon, so many doctors have difficulty detecting cases like Jenny's. Just to explain a little more to you, as Jenny's brain is growing, it needs to be able to push the skull bones apart, giving it room to grow. If there's a fusion in the suture, then the growth is inhibited and the brain is squeezed. Intracranial pressure can be extremely painful, so I'm really impressed that Jenny is as brave as she is. You know, she's a strong child.
Yes, that's true. She is. So, what are the options?
Well, my biggest concern is reducing that intracranial pressure, and we could do that with surgery.
Surgery? That sounds really dangerous. My pediatrician thinks it can be fixed with a helmet.
If the sagittal suture hadn't fused, then, a molding helmet might work, but not now. Every surgery has several risks, and especially when it's a head surgery. Jenny's otherwise healthy, so that reduces the risks. We'll double check to make sure that there's no heart or lung conditions which might interfere with the surgical treatment process.
I'm just really concerned. What exactly will this surgery involve?
Well, there are two options. Jenny's only 6 months old, so we can perform either a minimally invasive procedure or we can go with a traditional surgery. Let me explain the difference. With the traditional approach, we make an incision from one ear, go over the head to the other ear. It's the only scar that occurs in most cases. Typically, the hair hides it. Once the incision is made, the affected parts of the skull are removed. We create an opening for the brain to grow. We reshape the bones. We replace them back in a normal position, and once we're finished, the incision is closed, usually using dissolving sutures.
This sounds really difficult.
It is. I won't lie to you. It's a big surgery. It can last up to 8 hours. Craniosynostosis is complex. The operation requires the assistance of a number of different specialists working together. And after that, Jenny needs to be in the hospital for 3 days.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's no guarantee that the condition will be completely resolved after the surgery. Some children have some residual pain that we can treat with medications. For some children, a second surgery is needed, but that's very rare because the success rate is very high. It's over 98%. We've been doing this procedure for many years, very successfully.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So, what about the other procedure, the minimal one?
Well, no worries. It's important that you ask a lot of questions. The minimally invasive endoscopic procedure is one that we normally perform when the baby is young, typically younger than 6 months. We use an endoscope to open the suture. The procedure only takes an hour. Jenny would have to be in the hospital for maybe a night. She could probably go home the next day. After that, she would need to wear a holding helmet for about 6 months. We'd have to check it every 3 months to make sure that the sutures weren't closing early. So it's a simpler procedure. It can be equally successful when the baby's very young.
Okay. Is the helmet painful?
No, don't worry, it's not painful. It would be custom made. The success of the procedure is determined by how consistently the helmet is worn. After about 6 months, we'd know whether the growth was normal. If it's not, then we may have to do another surgery. The second surgery would be the longer traditional surgery. Both types are complex. We have to work with a team. My team includes a plastic surgeon and neurologist.
This is all overwhelming. How do I decide what's best for Jenny?
I know it's overwhelming. There's a lot to consider.
So you're pretty sure she needs surgery. A helmet alone won't work.
No, unfortunately, there's been fusion, and we have to correct it surgically. Plus, if you wait a month, then the simpler procedure probably wouldn't be an option because Jenny would be too old for that. Typically, we perform endoscopies on 2 to 3 month old babies. I strongly recommend that you talk to some other specialists in the field to get their opinion, because the more information you have, the better.
Okay.
I'll have my assistant print a list with contact details of my colleagues for you.
Thank you. This is very stressful.
I understand. I'm sure it's stressful and exhausting. Do you have family and friends to help you out?
My mom.
It's good you have your mom to talk to for support. Were there any other questions I can answer for you?
No. This is all really helpful.
I know it's a lot of information. Let me give you a pamphlet that has information about craniosynostosis, and it gives you the treatment options.
Thank you.
Again, if there are any questions, just let me know. We'll schedule another appointment and we'll address those concerns.